There's a new class of weight loss medication that are game changers. They're called the GLP-1 and GIP peptides. These meds have been around for about 20 years, developed to have diabetics improve their blood sugar control, but also having a side effect of decreased weight. This is weight loss that anybody can benefit from with diabetes, prediabetes, or normal blood sugars. They work in three ways. First of all, they change how your body metabolizes insulin. Insulin hormone determines where the food you eat is stored or used in your body. These medications help your body to have a more friendly relationship with insulin. The second way that they work is they work in the appetite centers of the brain, specifically to disconnect appetite from triggers and to help with cravings. Then the final way that they work is they slow down gut metabolism so your brain has a chance to catch up with the fullness signals from your stomach. Our clinic uses the compounded generic form of semaglutide and tirzepatide. These are the two medications that in the brand name are sold as Wegovy, Ozempic, and Mounjaro. By using the compounded generic form of the medications, we can bring the price down to an affordable level. The initial studies on semaglutide showed a weight loss of 15% over the study period, which was about 18 months. With Mounjaro or tirzepatide, the weight loss looks more like 20 to 22%. These amounts of weight loss vary from person to person. In my experience, we see weight loss of 1 to 2 pounds a week on average. These medications are compatible with most of the other medications that are commonly used, such as blood pressure medicines, statins for cholesterol, antidepressants. The only people who can't use this medication are type 1 diabetics, folks on insulin, folks on other medications in this class, for example, Trulicity, and we recommend against using it if you're trying to get pregnant, are pregnant, or are breastfeeding. We just don't know enough about the effects in those circumstances. These medications mostly work in the GI tract, so the side effects are mostly gut side effects. For example, about a third of patients will experience some nausea with the medication. The nausea is usually very manageable and happens around shots or around shot dose escalation. The problem with nausea is if the nausea gets out of control, it can lead to vomiting and dehydration. So we do recommend using an anti-nausea medication as a preventative. Other side effects have to do with bowel function, loose stools or hard stools, again, pretty manageable, usually with diet and over-the-counter meds. And finally, heartburn because of a slowdown in the emptying of the gut. Generally, you can deal with that with the timing of when you eat, and for example, Tums or Prilosec are very effective. Our program at Center for Wellness is a series of escalating doses of either semaglutide or tirzepatide. We start out with a lower dose and we can increase the amount of medications every 1 to 2 weeks depending on your weight loss and your tolerance of the medication. Generally, we think about our program in 16-week chunks because that gives us a chance to have you adjust to the medicine and see the full potential of the medication on your weight loss. All of our programs start with an intake visit. The intake visit is a chance to go over in depth your past history with weight, medications, diets you've tried, and how successful they are. It gives us a chance to look at what you're eating, when you're eating, and what your physical activity level is. The cost for the intake exam is $250. In addition, our medication program is a series of weekly injections with a physician or provider meeting every 4 weeks to go over how the program's working for you and to troubleshoot any problems that you might encounter. The semaglutide 16-week program costs $1,900. However, you can break the payment down into monthly installments. We do not have a strict diet or strict exercise associated with our weight loss program. That's because in the initial studies, they compared folks who were on a strict diet and exercise program versus folks who ate sensibly and moved as they were comfortable, and the difference in the amount of weight loss between those two groups was 1%. This gives you a lot of freedom in how you eat. In general, I recommend a Mediterranean type diet, rich in vegetables and fruits, lean protein, and healthy fats.